You are listening to the global network of podcasters dedicated to the pharmacy profession. Welcome to the Pharmacy Podcast Network.
Welcome to the Vaccine Confident podcast series, brought to you by the American Pharmacists Association. Over the next 3 episodes, we'll explore the critical role vaccines play in saving lives and protecting public health. Vaccines undergo rigorous testing to ensure they're safe and effective, offering long-term benefits for individuals and communities alike. By preventing the spread of serious diseases, they protect those who are most vulnerable, like infants and those with weakened immune systems. We'll tackle important topics like combating misinformation, understanding mild side effects, and addressing common questions, including concerns about fertility and the rapid development of vaccines like those for COVID-19. Join us as we empower you with credible information to build vaccine confidence and promote healthier communities. Let's dive in and learn how vaccines truly save lives. And now, here's part 1 of Vaccine Confident.
Hey, welcome, podcast listeners. My name is Todd Urey, founder of the Pharmacy Podcast Network, and this is the APhA Vaccine Confident 3-part series. We are thrilled to be here in the studios, Western Pennsylvania, but this is going out on a national level. As a matter of fact, we reach international levels, and we understand the importance of pharmacists collaborating with other healthcare providers and making sure that the people are safe. People are getting the vaccines that they need, and they're confident about that. I'd like to turn it over to Brigid and the APHA's team. Brigid, take it away.
Thanks, Todd. Really pleased to be with you all today. As Todd mentioned, my name is Brigid Groves. I'm our Vice President of Professional Affairs at the American Pharmacists Association. Pharmacists have been vaccinating America's public for many years, and we're really pleased to have an initiative called the Vaccine Confident Initiative that helps pharmacists to learn about vaccines, to help pharmacists feel confident and comfortable in identifying and recommending those needed vaccines. And as such, we've created a variety of different resources, content, and materials based on the experiences that our pharmacists have had over the course of many years, and then looking forward into continuing to instill and grow confidence among America's public about the importance and the value of vaccines and preventing diseases that can be done so through vaccination. I'm really excited to have some 2 co-hosts and guests with me today who have been very essential in a lot of the work that we've been doing and this initiative in particular, as well as helping us to move items into the next iteration of this project overall. So I'm first going to introduce my colleague, Mitch Rothholz, who, as a former APhA staff member, was essential in getting this initiative off the ground, and I'm really pleased to have him with us. Mitch, would you like to introduce yourself?
Yes, thanks, Brigid, and thank you for having me on this podcast with you today. As many of you know, I've been working on behalf of the profession for more than 30 years, advocating for the profession and for the patients we serve in the area of immunizations and public health improvement. And this is an area that has meant a lot to my professional career, and APhA had provided me the opportunity to represent all of you on this podcast, because as association professionals, neither I nor Brigid or anybody else who works on behalf of the profession for an organization could do the work that we do without practitioners who are on this call, whether it be pharmacists, technicians, or others. You're the ones who do the heavy lifting. We just advocate and promote what you do. So thank you for having me, and look forward to the conversation.
Wonderful. Thanks, Mitch. And really appreciate that all that you've done over the course of your storied career to help advance the pharmacist role in providing vaccines and helping to get this initiative in particular off the ground. Next, I'd like to introduce my colleague, Luke Berenbrok, who has recently joined this initiative to help us build, in particular, some really unique maps that we'll describe and showcase later on. Luke?
Thanks, Brigid, and thanks, Todd, for having me in person. I'm a proud Western Pennsylvania native, which is how I got to join you here in the studio. I'm a pharmacist and faculty at the University of Pittsburgh School of Pharmacy. And yeah, I joined this project because I fell in love with map making back in 2020. And I really like to show people where they can get access to healthcare services, and that happens to be at community pharmacies. So over the next few episodes here, we're going to show you these maps and walk you through them. I can't wait.
Fantastic. Thanks, Luke. I did also want to highlight one of our key partners in this program and in this initiative overall. The funding support for these efforts came from funding dollars issued by the CDC through a cooperative agreement there. Recognizing they're not joining us today, the work that we have been doing doesn't always necessarily represent the voices and opinions right off the bat, but they're highly supportive of this effort of pharmacists engaging in vaccine administration, and we make reference to many of the CDC guidelines and recommendations that are available out on the web. So we'll be calling those out throughout the day as well. So first, we want to start really helping you out in the world, helping to build trust in vaccines and vaccine programs. Then we'll move into how engaging with communities and others to help facilitate vaccine distribution and administration. And then finally, talking through some accessibility and using maps to help identify some pharmacy locations near you or near your patients to help getting vaccines in their arms for their families. So we kind of want to start here with looking at the importance of trust as making sure that's our basic foundation for vaccine confidence. Mitch, I'm wondering if you would be able to describe to us what the CDC's Vaccinate with Confidence framework is and how people might be able to use it within their everyday practices.
Yeah, Brigid. So the CDC's Vaccinate with Confidence was really to address something that we as pharmacists have been doing for a long time with our patients. And it's really, protecting our communities and really making credible information available to the patients we serve, addressing myths and misinformation, and really to build the trust in the vaccines, but also the professionals who deliver the vaccines. And so in pharmacy, as you all know, we have been working this for a long time. And the public trusts pharmacists, not just for vaccines, but all the care that we provide. We're the most accessible healthcare provider in those communities. We're approachable. And so the CDC has seen that value and have asked the profession what we could do. And that going back from the very early days of immunizations, that's how we got started really on a big scale, is we were approached by the Secretary of Health and Human Services, Donna Shalala at that time, who said, and this was during the childhood vaccines early days, how can pharmacists help? And with the foresight of the leaders at APhA and others, we came back, we did some strategizing, and we said, we can make a difference. We can be a conduit. And one of the roles, we have one of three roles, or all three roles. One at a minimum is providing education. Second, it's being a facilitator, using our practice sites, working with other health professionals in public health to come in and serve those communities. And then in the states where we have the authority to actually administer the vaccines. And, I did a lot of pondering over the last several years and thinking, if we didn't take those steps back those many years ago, where would we have been during the pandemic? And that was really eye-opening because that was significant. That provided us a lot of opportunity and really, in my mind, demonstrated the value that pharmacists provide to public health. I wish other people saw it earlier. I wish we could see that we don't have to do all this fighting to get coverage, because that was the case that really showed. Think about how much we did during the pandemic. And so the campaign that CDC has really is just the reemphasis of that, taking that access that pharmacists have and seeing how they can optimize it to reach hard-to-reach communities.
Wonderful. Thanks, Mitch. And I think we'll have some ideas and suggestions on reaching those communities and partnering with them in some of our coming sessions and episodes here. I know that pharmacists are, as a practicing pharmacist, I still get out there the opportunity to give vaccines to some of our older adult patients, but it's really valuable that we have that trust. We are looked at as one of those trusted members of our communities, and also to partner with other, individuals that are in that patient's communities. So thinking about that role of vaccine provider and helping to connect to care, Mitch or Luke, I'd love to hear, some of the things that you've experienced or heard, how we can help to bolster that trust in pharmacists. So patients know that they can really go to their pharmacist to ask those questions, to, be able to get some information and education when potentially there might be some myths or misinformation circulating, where that pharmacist fits in as that trusted healthcare provider.
So really, when you think about the trust, it's really being that credible source of information. And so and especially in today's environment, because we all know there's a lot of information that's not accurate and things are made up. And so I think we've built the trust with the public and we need to maintain that. And so it's really going back to credible sources of information. And what we did several years ago, and this was really back in 2012, that we came up with the term immunization neighborhood. Mm-hmm. And there was a reason we did that. The reason is that we needed to demonstrate that role. So in reality, we were all public health professionals. And so it's the patient who's at the center of what we do. And so it shouldn't matter who the patient gets vaccinated with, it's that they get vaccinated. And so the immunization neighborhood was created along the 3 C's: collaboration, coordination, and communication. And so you could use it for immunizations, you could use it for other disease states. You take that approach to care, the patient benefits from it. Mm-hmm. And documentation then is really the fourth part of the equation. But it's really making sure that individuals and communities are protected from vaccine preventable diseases. And so making sure you have credible resources, and then don't get into a battle with a patient, but help educate. Mm-hmm. So just say, listen, understand, and then say, I hear you. Here's some other information for you to consider. And one of the key things too is just because somebody asks a question doesn't mean they're anti-vaccine. And so I also term those individuals as vaccine contemplators. Mm-hmm. They're thinking about, they just need more information to help them get over the line. And so that's part of our role as that trusted healthcare professional to provide that information. Many on this call may also say, well, that's going to take a lot of time and effort that I don't get paid for. Well, there are efforts, and APhA has been there for a long time, really trying to advocate for that time that we spend counseling patients. And in immunizations, especially in the environment we're in today, it's going to become more complicated and it take more time. So again, provide the information. Don't feel bad if the patients don't take it right away, but they'll be thinking about it. They'll be contemplating what you say. And then you'll find they'll come back. And we found that during COVID, and we find it every day in pharmacy practice. They may not listen and do it right away, but sure enough, they'll come back. And what I have found personally, when I've done vaccinations and done the counseling and all that, they may go away. But when they come back with themselves, their family members, and their friends.
So true, Mitch. I think that really also the immunization neighborhood that you referenced, bringing back the folks in their neighborhood, their friends, families, neighbors. So you mentioned on, having some credible sources and really listening to the patient. Luke, I know there's a concept called motivational interviewing. Many of our pharmacists, student pharmacists, and others out in the healthcare environment might be familiar with. How can we utilize some of the tools, techniques, and tips of motivational interviewing when using and talking with patients about vaccines?
Yeah, that's a great question, Brigid. And Mitch, I want to go back to a couple of things you said. I think it's kind of no-brainer to look at the pharmacist now as this public health expert, because we're in the communities, we're the people who are implementing these initiatives, and sometimes right away, whenever an alarm is sounded, or sometimes it's about prevention too. And then also that point where you said, it's going to take a couple times with some people. I always try to stratify that with my students whenever I'm teaching them motivational interviewing in the classroom and with standardized patients. And, there's going to be some percentage of patients who come to you saying, I want a vaccine. I got 2 vaccines yesterday. That was me saying, hey, I'm here, I'm willing, this is what I want. And there's going to be some people who have to be asked by you as the pharmacist and offered that vaccine, and some of them will be willing right away and some of them won't. And I think sometimes students or people who are new to offering vaccines look at that as a failure when someone says no, or maybe let me think about it, or I want to delay a decision. And I never really look at it like that. And I teach my students that sometimes it's multiple conversations, and you have to really respect a patient's autonomy when you're thinking motivational interviewing and their decision making. But also you have to be willing to say, hey, can I share with you some education materials? Can I slip this pamphlet, across the counter and put it in your bag? Are you willing to hear more about the things I heard you share with me? And here's some extra information for you to look over. And I think those conversations are also worthwhile having. And yes, they take extra time, but they can be valuable to get that person to come back again.
Excellent. Thanks, Luke. Yeah, those are some really poignant remarks around asking, are you willing to, is now a great time? Can we have this conversation? I have information and some resources available. Are you willing to, are you able to right now kind of accept and talk through that, or share that and have them come back? I think those are really well poised ways to increase confidence within our patient populations.
Well, just another example, Luke, I love the example about, the vaccines at the same time concern that the patients have. We also have to walk the talk. If we're recommending vaccination to patients, we have to feel comfortable that, we would do it for ourselves and for our family members. Good example, when I did talk, concomitant administration, well, this past fall, I got 3 vaccines at one time. People thought I was crazy, but I'm here to talk about it. And so that's how, when I talk to patients about it who have questions, I said, it's not going to harm you. This is what we expect. I did it myself. So, being able to show that you're willing to do it for yourself or your family members helps a lot of people get through this.
I want to tag on to that, Mitch. This year in particular, my dear friend who's a pharmacist, she gave me my COVID and flu vaccines this fall, and had 2 of her 3 children who watched me get my vaccines, because one of them in the past had watched me get my vaccine. And when they went to their pediatrician's office to get their annual flu shot that following year, they were like, oh, like Auntie Bridge, she got a shot, I can get one too. So I think that's so important to help demonstrate to others, especially those who might be apprehensive that around, needle phobia or other concerns, that it's something that you could do, but it's not that hard, it's not that difficult, and it makes such a big impact on your own personal health, but for those around you, and to really help instill the confidence by demonstrating and walking the walk, talking the talk, as Mitch said. I want to pivot a little bit into thinking about some of that misinformation and distrust that we've heard, and recognizing there's a ton of different places folks can get information out there. Mitch, one of the things you had mentioned is assuring that we have credible information. How do we know what a source of credible information is, and how do we know what the safety and efficacy rates of these vaccines are?
Great question, Brigid. And the CDC is probably one of the best places to go to get that information. It's been studied, but there's also another site to go called immunize.org that has a lot of great the information for healthcare professionals, but also for the public. And then, of course, APhA also has some great resources that you can access to. Again, trying to make it easy for the practitioners. You shouldn't have to recreate. Use the tools that are there to make it make it help you out so that you've got the right information and it's credible. Again, that's the key thing. Given what the environment that we're in today, and we're hearing it today in terms of what's going to happen with the upcoming administration and the vaccines, my big concern as a healthcare and public health advocate is that we're going to take steps back. We've eliminated polio. That's significant. The rates of hepatitis B, which is really the concern with hepatitis B, is prevention of cancer. We've had great rates, but as these things get questioned, the studies are there. Looking at the information, looking at the studies, getting your information from credible healthcare practitioners. There is a site that immunize.org actually has that they've gone through all the different immunization information sites, and they've listed which ones are considered credible. Go there, look at what they have, listen to other podcasts or other information from sources. One of the people that I follow is a good friend many years, a pediatrician actually out of the Pittsburgh area. Not that I'm, because we're talking out of Pittsburgh, but Dr. Todd Wallen, who is a pediatrician who has been working in the area of immunizations, and is actually, his practice was actually, I would call attacked, but they were onslaught by anti-vaxxers trying to shut down their site. He overcame that, but he provides good practical information and real life information for healthcare practitioners. And he has something that's called the Trusted Messenger Program. Great guidance there on how to address questions that are come out around vaccines. So it's really, again, as we talked about earlier, listen to the concerns, provide credible information, and let them digest it. So that's part of the information is look at where you're getting your information from, look at what your public health departments put out, and use it and share it. Don't try to recreate, because one of the big concerns we have in the public health community is that patients are getting information from so many different sources, and some of those messages conflict with each other. Even messages coming out from government officials they're not in sync all the time with what the healthcare professions are saying. And so we need to make sure we're in sync, because if we have confusing messages or conflicting messages, the public's going to be confused, and they're just going to put their hands up and say, I'm not doing it. Yeah. And so we've got to be consistent and credible in the information.
So true. Making sure that we're all on the right page with the accurate information and helping them to find that place to go. One of the places I would encourage our listeners to check out is vaccineconfident.pharmacists.com. So there's a variety of different resources, materials, and other stories, conversation guides, etc., that are available on this website for no charge. So you're welcome to hop on there at any point. We had seen some really great successful examples of pharmacists working in the field and partnering with others through the Success Stories tab. The conversation guide there has some good hints and tips on how to address some myths and disinformation that is out there and how to address some of the concerns. So I would encourage you to check that out. So we've talked through a variety of tools and techniques that our pharmacists can use to really help increase and foster trust with our patients regarding vaccines through this first episode. Really appreciate you listening in for our initial inaugural episode of our Vaccine Confidence series. And we're excited to continue the discussion and more on our next episode of how we can continue to engage in partners with others in vaccinating our public.